Support for this podcast comes from the Central Valley Journalism Collaborative, connecting communities with the resources, infrastructure, and networks to ensure a vibrant local free press.
From KVPR in Fresno, this is Central Valley Daily. It's Wednesday, July 30th. I'm Elizabeth Arkalian. Millions of dollars are on the line in a funding battle between the Trump administration and Planned Parenthood.
If this bill is found to be constitutional and go into effect, Planned Parenthood Monte, which operates health centers all throughout the Central Valley, would lose revenue of $100 million.
But Planned Parenthood and attorneys are pushing back. We will hear what the proposed cuts could do, but first, these headlines. Search crews have found the body of a Southern California woman who was missing in Sequoia National Park. KVPR's Rachel Livenall reports the woman was swept away by a river in May.
Jo Marie Calasanz was a 26-year-old from the city of La Puente in Los Angeles County. She was hanging out with friends and family in Sequoia during the Memorial Day holiday when she was swept into the Cahuilla River. Her family says she jumped into the river to save her sister, who was in danger, but Calasanz was never seen again. The Tulare County Sheriff's Office and National Park Service worked with a rescue team to locate her body for 2 months. Officials say the search took longer than usual due to unsafe water conditions and terrain. Family of Calasanz called her selfless and fierce in a GoFundMe post online. For KVPR News, I'm Rachel Livenall.
And a woman visiting Yosemite National Park was killed earlier this month. Park officials say the girl was hiking with her boyfriend and her friends in Tuolumne Grove when she was hit by a falling tree branch and killed instantly. She was identified as Angela Lynn, and she was a 29-year-old software engineer. The incident is still under investigation, and Tuolumne Grove remains open to the public. California Attorney General Rob Bonta announced on Tuesday the state is suing the Trump administration for withholding Medicaid reimbursements from Planned Parenthood. Cap Radio's Laura Fitzgerald reports.
Planned Parenthood affiliates of America and affiliates in Massachusetts and Utah are already suing the federal government over a provision in the Big Beautiful Bill that withholds Medicaid reimbursements from their clinics. On Monday, they won a temporary protective order. But Bonta says California needs its own lawsuit as the legal battle plays out.
Who knows what decisions will be made down the line. It's important that everyone who is harmed, everyone who is treated unlawfully, here Planned Parenthood, as well as the state of California, bring their case.
The lawsuit argues the Federal Budget Act violates Planned Parenthood's First Amendment rights, saying it's being targeted for advocacy around abortion access. It also says the language is ambiguous, making compliance difficult. 1 in 3 Planned Parenthood patients nationwide get their care in California, and around 80% of those California patients are on Medicaid. Jody Hicks heads Planned Parenthood affiliates of California. She says California has the most to lose without this funding.
This defund provision is certainly an attack on values, most heavily on California. So I think it's important that we are taking this multi-pronged approach on where the harm is.
As of now, Planned Parenthood clinics in California can continue getting Medicaid reimbursements under a temporary protective order issued this week. In Sacramento, I'm Laura Fitzgerald.
Fresno Democratic Congressman Jim Costa met with leaders this week at Adventist Health in Reedley. Costa's visit sought to highlight the funding cuts to Medicaid made in the Big Beautiful Bill that could impact hospitals. Costa's office estimates that rural hospitals could lose 21 cents for every dollar they receive because of cuts to Medicaid reimbursements. Adventist Health officials recently told KVPR they plan to keep doors open despite the looming cuts. The University of California is admitting more in-state students this year than ever before. Officials said this week the UC is admitting more than 100,000 first-year students from California this fall. That's a 7% increase from last year. On average, almost 3/4 of all students who applied to a UC campus this year were admitted.
Support for Central Valley Daily comes from Fresno Mazda, part of the Prieto Automotive family, leading the industry in the IIHS 2025 Top Safety Pick Awards, helping move Mazda closer to the goal of eliminating traffic fatalities. More information and the Mazda digital showroom available at myfresnomazda.com.
And now to our main story. Among the many organizations in the crosshairs of President Trump's administration is Planned Parenthood. One provision in the One Big Beautiful Bill Act seeks to halt Medicaid payments to abortion providers who receive upwards of $800,000. This immediately put Planned Parenthood squarely on the chopping block. The decision outraged many and prompted the closure of 5 facilities in Planned Parenthood's regional office that covers much of California and Nevada. It's known as Monte. While abortion has been effectively banned in several U.S. states, others, like California, have vowed to be a haven for those seeking care. Andrew Adams leads strategic communications at Planned Parenthood Monte. In a statement, he called the federal funding cuts a, quote, backdoor ban on abortion in reproductive freedom states. And as you heard in the newscast just this week, California's Attorney General Rob Bonta filed a lawsuit against the Trump administration over the cuts, saying that it violates Planned Parenthood's First Amendment rights. And a judge this week also ruled that Medicaid reimbursements should continue to flow to Planned Parenthood for now, too. That news was just breaking when Andrew of Planned Parenthood Monte joined me this week for a conversation. He applauded the decision that allows his organization to continue serving Medicaid patients. But, he says,
unfortunately, today's preliminary injunction doesn't change the fact that we have 5 health centers that we closed last week that will remain closed. And as the case continues, we anticipate that the Trump administration will appeal this decision. With many court cases these days, especially involving abortion and sexual reproductive health care, these court cases can be a real roller coaster. And so Planned Parenthood Monte has made the decision at this point to, just as we did on July 4th, after the president signed this reconciliation bill, to continue to provide healthcare to our patients. 80% of our patients in California do use Medi-Cal or Medicaid to access that healthcare. We've just chosen not to bill since the beginning of July when that bill was signed. So for all intents and purposes, the healthcare we provided to 80% of our patients who use Medicaid, we have not sought reimbursement for that care as of today.
Okay, a couple things I want to circle back to, including some of those closures, which will impact a facility here in the Valley. But just to backtrack a little, Trump recently signed this spending bill that said essentially Planned Parenthood would lose hundreds of millions of dollars. But Planned Parenthood is not technically named in the Big Beautiful Bill. So can you elaborate more on why you all will be impacted so significantly?
So the reconciliation bill that Congress passed and President Trump signed on July 4th, we argue in court, includes a provision that unconstitutionally defunds Planned Parenthood. And that's what the court has given a preliminary injunction from going into effect. What that provision says, it says 4 things. It defines an illegal entity as, 1, a 501c3, which is a nonprofit organization. Number 2 is a central community healthcare provider specializing in sexual and reproductive healthcare. Number 3, that entity provides abortion. And number 4, that entity receives more than $800,000 in Medicaid reimbursement. So like all healthcare providers who take Medicaid, you provide healthcare for someone and then you bill. So that's where that number comes from.
Okay.
What we know is that that definition, even though it doesn't say Planned Parenthood, that is by definition Planned Parenthood. And that's what the judge in federal district court found as well, that just because the Congress didn't say Planned Parenthood, that description almost exclusively applies to Planned Parenthood.
Now, specifically the Marmani region of Planned Parenthood, which is where we are, will lose about $100 million. Walk us through examples of where these cuts in funding will be felt.
So if this bill is found to be constitutional and go into effect, Planned Parenthood Monte, which operates health centers all throughout the Central Valley, as well as other places in California and Nevada, would lose revenue of $100 million in fiscal year 26. Where that number comes from is looking at 80% of our patients use Medi-Cal in California and Medicaid in Nevada to access their health care. And if Planned Parenthood, due to this bill, is blocked from receiving reimbursement for those expenses, that lost revenue will total about $100 billion. So if that goes into effect, we would no longer be able to provide care for people using Medicaid insurance. We can still see them if they have other insurance, which of course they don't, or if they can pay cash. But we know that people who use Medicaid have it because it provides insurance support for them because they are at a lower income.
So, as part of your announcement of how this loss of funding would impact you all, you announced that 5 of your health centers would shut down, including a Planned Parenthood clinic in Madera. Can you tell us about the communities where these centers are and the impact that closure could have?
Yeah, it was really devastating last week to close 5 of our 35 health centers that Planned Parenthood Monte operates throughout California and Nevada. The 5 health centers that Planned Parenthood Monte closed last week were located in South San Francisco, San Mateo, Santa Cruz, Gilroy, and Madera. And how we came about making that decision was realizing that just since the defund provision of the reconciliation bill was passed, that for the month of July, Planned Parenthood Monte continued to see patients who have Medicaid insurance, but were not billing for those services. So we were looking at a loss just in the month of July of $8.4 million. And we knew that that was not a sustainable business model we could carry forward. So these cuts we had been considering with our board of directors and our leadership team for months, as we knew with the Trump administration coming in January, that these types of cuts and attacks on sexual and reproductive health care would continue. And so when we were identifying these 5 health centers in particular, we looked at a myriad of interrelated factors, including physical infrastructure needs and requirements. We also looked at the availability of patients to travel to other Planned Parenthood Monte health centers nearby. And then we also looked at, are there other safety net providers in that community who may provide some services to lessen the impacts on the patients and the communities?
So what's your game plan moving forward as you navigate this political and social environment that we're in right now?
So this preliminary injunction is a short-term victory, but we know that there's really a long road ahead. And we suspect that the Trump administration will appeal this preliminary injunction and use every tactic at their disposal to seek to stop abortion care, to destroy Planned Parenthood as an organization, and to block federal funding for sexual and reproductive health care. This, of course, is in addition to substantial cuts to Medicaid that came out of the Big Beautiful Bill or Reconciliation Bill that fully go into effect in 2027 and 28. But Planned Parenthood Monte is not backing down from this fight. Defunding Planned Parenthood is an unconstitutional attack that will decimate abortion access nationwide and really harm patients with Medicaid here in California, in the Central Valley, who come to Planned Parenthood Monte health centers for care. So Planned Parenthood Monte is working with the state of California and with philanthropic partners to build bridge funding to help the organization establish a new, more sustainable business model that does not rely on any federal funding. We think that it's important for Planned Parenthood Monte to develop that business model that is completely unreliant on federal funding, because we know that the Trump administration has 3.5 years remaining, and there's efforts to defund this care are not going to stop.
Andrew Adams, head of strategic communications at Planned Parenthood Mar Monte. Thank you so much for your time.
Thank you.
And that's today's show. If you'd like to hear more about how changes to Medicaid are impacting hospitals in our area, listen to our July 28th episode of the podcast. KVPR's Rachel Livenall explains how billions of dollars in Medicaid cuts could impact the Valley's fragile healthcare system. Today's episode was produced by Jonathan Linden and KVPR with support from the Central Valley Journalism Collaborative. I'm Elizabeth Arkalian. Find the latest local news anytime at kvpr.org.
These days, there's so much news, it can be hard to keep up with what it all means for you, your family, and your community. The Consider This podcast from NPR features our award-winning journalism. 6 days a week, we bring you a deep dive on a news story and provide the context and analysis that helps you make sense of the news. We get behind the headlines. We get to the truth. Listen to the Consider This podcast from NPR.